Hi, I'm Alexis Cate. I'm a licensed clinical social worker and trauma specialist. Let's go over what depression looks like in women. Please make sure to check out the description below for useful resources that we've linked to this video. In this video, we'll discuss signs of depression in women, common symptoms, 3 types of depression often unique to women, causes of depression in women, and how to treat depression in women. Depression is a mood disorder that affects a person's thoughts, feelings, and behaviors. Most people will experience depressive symptoms at some point in their life. However, a person with a diagnosis of depression experiences these symptoms to a greater severity with a specific duration or longevity of symptoms that can vary in intensity. Symptoms of depression include sad mood, difficulties experiencing pleasure in life, low energy and low motivation, changes in sleep, appetite, and the feelings of depression and at times associated weight gain can significantly interfere with a person's daily life and functioning. Depression can feel incredibly isolating and very lonely to a person that is in the midst of it. If you notice that someone may be feeling depressed, don't feel afraid to check in on them. If someone shares with you that they are feeling suicidal, support them in calling 911 or going to their nearest emergency room. Local law enforcement can also assist in performing wellness checks on any person that you are concerned about. Here are some common signs of depression in women to look for: significant weight loss or weight gain, social isolation from friends, family, and in relationships, lethargy or increased fatigue, lack of participation or enjoyment in activities that they have previously enjoyed, seeming to move more slowly than usual, a change in hygiene or appearance, negative self-talk, and any talks about death or dying. Depression symptoms and severity will vary. Many women with depression experience sadness, emptiness, fatigue, and have trouble sleeping. Please note that if you or someone you love is experiencing suicidal thoughts, help is available by dialing 988. Diagnoses of depression are often diagnosed by therapists or psychiatrists. However, primary care providers and women health providers, such as OBGYNs, can also support in an initial receivance of a diagnosis. Common depression symptoms in women include persistent feelings of sadness, emptiness, and hopelessness, inability to enjoy things, significant weight changes or appetite changes, sleeping too much or too little, fatigue, trouble concentrating, feeling worthlessness or overly guilt-ridden, and thoughts about death, dying, and suicide. Hormonal and lifestyle changes that occur during menstruation, pregnancy, and menopause are to thank for the specific depressive episodes that only affect women. These types of hormonal changes can also exacerbate existing depression and anxiety. Here are the 3 types of depression unique to women. Premenstrual disorder, or PMDD. Some women experience some form of premenstrual symptoms, or PMS, in the days before or during their period. PMDD is marked by a significant change in mood, ability to engage in activity, and behavior changes that are so severe that everyday life is affected. PMDD is also different from major depressive disorder in that the symptoms may be slightly more minimal and often resolve in a week post-menses. Postpartum depression. Pregnancy and the birth of a child causes a massive shift in hormones as well as lifestyle change. Most women experience a shift in mood, feelings of sadness, and fluctuating mood in the weeks following delivery. This is often called baby blues. While baby blues is an expected phenomenon, postpartum depression occurs when symptoms increase or fail to resolve over a period of time. Perimenopausal depression. Due to the vast number of hormonal changes in the perimenopausal period, which is the time of transition for women prior to menopause, many women find their moods become erratic during menopause and they experience depression. We've linked articles on PMDD, baby blues, postpartum depression, and menopause and depression in the description below for further reading. While the causes of depression are still being actively researched and debated, there are some issues that are known to increase the risk of experiencing depression for women. Here are a few possible causes for depression in women. Hormonal changes that are associated with menstrual, pregnancy, childbirth, and menopause can cause changes in brain chemistry, and these changes can be associated with depressive episodes. One study showed that 12.4% of women experienced a depressive episode during their pregnancy. Another study has shown that 13 to 18% of women of reproductive age experience premenstrual disorder, which is severe enough to cause impairment and distress. Family history of depression. Genetics may also be a factor. One study showed that major depression is likely to be inherited on the low end in a 31 to 42% range. Childhood trauma. Research has demonstrated that exposure to trauma in childhood significantly increases the experience of depressive symptoms later on in life. Trauma, loss, experiences of violence, and other life crises can trigger symptoms of depression. Depressive symptoms that present only after a traumatic or stressful life event may also be a sign of post-traumatic stress, an acute stress disorder, or an adjustment disorder. Treatment for depression. Treating depression is often achieved through talk therapy and medication if medication is warranted. At times, medication is necessary in order to provide a boost in energy, a boost in motivation, and hopefulness to engage in the therapeutic process. Medication for depression, such as selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are often prescribed to treat symptoms of depression in women. These medications facilitate the production of certain neurotransmitters in one's brain chemistry in order to support a more healthy and stabilized mood. Some people find that medication needs to remain constant for them in order for them to achieve consistent effects of improved mood, while others are able to work with their psychiatrist or prescribing doctor in order to come off of their medications once they have established a supportive network as well as coping skills to manage any increases in depressive symptoms. There are a number of types of depression therapy that can be very helpful, including interpersonal therapy, psychodynamic therapy, and CBT for depression. Many therapists will utilize an eclectic approach of talk therapy with regulation skill building and allow the client to develop strategies to support mitigating their depressive mood. Reaching out to a primary care physician or one's OBGYN can often be the first step in receiving treatment. A medical provider can often refer you to a therapist, and likewise, asking a trusted friend or loved one for support can be very helpful. Also, if you would like to find a therapist that accepts your insurance, you can reach out to your insurance company for in-network providers. Using an online therapist directory can also be supportive in finding a therapist that specializes in depression in your local area. We've linked several resources in the description below to support you in finding a therapist, psychiatrist, along with other useful tools. Please remember, you are not alone.